Welcome to another episode of Follow the Brand. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal story, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. One of the biggest challenges in healthcare is revenue cycle management, the continuous struggle between providers, payers, and patients in claims management is worldwide. This is the Follow the Brand podcast with host Grant McGaugh, and we would like to explore this mounting problem with an industry expert, Bernadette Albury. She talks about budget, goals, and dialogue as keys to understanding denial management. Bernadette also helps providers maximize their payer contracts and gives proven strategies to overcome the denial of a claim. Bernadette Albury, President and CEO of Gateway Healthcare Solutions, provides high-quality program, project management, and professional services solutions to local, regional, and national clients in the healthcare industry. She is a visionary professional focused on developing quality solutions and delivering exceptional results. She is committed to enhancing individuals, teams, and organizations' efficiency, effectiveness, and overall performance. While operating in her passion, she provides leadership and professional development at all workforce levels, from direct service workers to management and executive team members. The birth of GHS started with an entry in a journal during graduate school that propelled the vision to establish a compelling and energetic organization to satisfy the solution to many challenges faced within the healthcare industry. Ms. Albury quickly began to create the foundation by fueling her passion for coding, contractual language, and maximizing strategies, thus laying out the framework for the early stages of GHS. Bernadette Albury merged with several dynamic organizations to better assist in gaining the necessary knowledge to operate in wisdom and the spirit of excellence. Since then, Bernadette Albury has brought a wealth of healthcare industry experience, along with a great deal of employee engagement, workforce development skills and experiences, and a deep understanding of operating and developing a cohesive environment. She specializes in transformational consulting in healthcare, denial management, employee and customer engagement services, reimbursement methodology, revenue cycle management, medical coding analysis, strategic planning, professional development and training, executive and professional coaching, monitoring and compliance, and oversight services. Ms. Albury has the proven ability to monitor, assess, and turn around failing programs and immediately implement effective remediation plans. She establishes interconnected teams and works collaboratively with staff, project teams, and community partners. She benchmarks integrity, establishes appropriate use controls and performance metrics to gauge program effectiveness, and maintains accountability for implementation. Ms. Albury has a passion for excellence that serves as the foundation for driving client satisfaction, high-quality results, and project success. Selecting the right healthcare solution advisor can bring you the management services you need and the peace of mind you deserve. Please welcome Bernadette Albury to the Follow the Brand show, where we are creating a 5-star brand that you can follow. Welcome, everyone. We're here on another episode of Follow the Brand. We're going to bring up an industry expert in the benefit claims area. She is the president and CEO of Gateway Healthcare Solutions. And we've been talking amongst ourselves for the last, maybe it's been a year or two. We actually met through the National Association of Health Services Executives back in 2018 when she was working, I believe at that time, for Nicholas Miami Children's. And now here we are 3 years later. We've been talking heavily in the last year or so. I've been helping her to develop her particular program and what she does from a business perspective to help organizations to be more effective. So before I keep going on and on and on, I want to bring up Miss Bernadette Albury, have her introduce herself, and we can get directly into the show. So without further ado, Miss Bernadette Albury.
Hi, and thank you. I am grateful for this opportunity. I'm Bernadette Albury. I am the founder of Gateway Healthcare Solutions, which is a healthcare finance organization that structured to handle complex challenges for physicians, clinics, and the healthcare scope of their claims background. And my background initiated from the healthcare sector right in South Florida. And I've been in healthcare for over 21 years in various capacities in the healthcare sector with my journey with hospital settings and also the payer side. The hospital that I initially started with in South Florida was Broward Health. And I began many years there in various capacities with my claims background there. And I did various positions there that skilled me into the position that I am in today, which is the scope of denial management, which is a very complex scope with handling claims and assisting providers on how to restructure and provide great resolutions for them with their claims filing.
Excellent. So I know that you're an expert. You'll say you've been doing this for 20 plus years. Now you're prompted to go ahead and start Gateway Healthcare Solutions. You've got a website out there now. Your clients can kind of see kind of what you're doing. But help me understand this a little bit more. If someone's wanting to pursue a career similar to yours, what advice would you give them?
The advice I would give them to starting off a career as similar to mine is to create a contact goal, provide a realistic timeline of what it would take for you to launch and what prospects of this sector you would like to take on. For me, my sector, I specialize more in contractual maximization, helping physicians maximize their true contractual agreements and deep diving into scopes to better their organizations. And someone that would choose to do another sector, but within the healthcare finance sector, the advice I would give to them would be to not only create a realistic goal, but create a budget and also create a dialogue sector where you can tap into knowing your market, do your research and finding the best subjects possible for you. And what you can do once you learn that is to master in that field.
Excellent. And I noticed also on your website, you've got a download, and it's called Medical Necessity Appeal Template. And I believe you're using that as a way to showcase or actually help individuals that are out there in working in the finance department or they're working in their particular practice, medical practice, and they're having problems with claims denial. Can you help us understand what are they going to get by reading that information?
Yes, actually, they're going to get a wealth of information by reading that. I actually give them the instructions on how an appeal works, what is actually expected in the appeal, and I show them mechanism of how to appeal it successfully and get a return where it's overturned. And I give them strategies on what's expected in that appeal. For instance, when a service is denied for medical necessity, most times it may not be just because the services were not medically appropriate. It could fall into a place where some codes with the services are procedure coding are with the payors are diagnosis driven. So if they came in for, let's say, a labor check, and they indicate on the actual claim form as a diagnosis as an encounter of pregnancy, or with a strands of diagnosis. If it's not specifying specifically within the scope that the payer has embedded into their payer side to determine what should be commonly as a diagnosis, then that service code may be denied. Or it could be, for instance, the patient truly needs to have a medical procedure, surgical procedure done, but that surgical procedure, that doctor embedded into the service code as the diagnosis, they embedded that the services were based on a family history. And then the second code, they actually told, well, this patient actually has signs of chest pain and they need to have an MRI done or CT. With that being said, if that patient truly needed it, in the notes, it's going to tell a story of what's transpired. And in the story, 9 out of 10, the majority of the time, the patient's history does specify that the patient did have the true signs, and their history would have mandated them to have the service rendered. But because you flagged with an encounter of family history, they're going to initially think this is not medically appropriate. This doctor's just doing a random necessity test for a purpose of preventative. And that preventative test sometimes doesn't meet the criteria because you've coded it as that. But if you would have initially said, not only does the patient have a family history of heart disease or a number of factors, and if you would have just said the patient came in with chest pain and I need to do the service because of that, then it would have been considered. So you would have to justify more in detail with your notes, and also in that appeal, providing in-depth information as to why this patient needed the services rendered for overturn of the services denied.
Wow. Now that is a wealth of information that's important for a lot of different people. We hear it all the time that claims are being denied. This is a time where reimbursements are very, very top of mind for a lot of different facilities, and they do not want to spend the time going around and around with claim denial. So I can see why utilizing your services would be a major benefit. And I wanted to know, how do you, because you're an expert in this field, how do you continue to stay up and learn and know that you're on top of your game and all these different facets that aren't readily available for people as far as getting that type of information? This episode is brought to you by 5-Star BDM. 5-Star BDM is a professional consulting and advisory group keenly focused on business development services for small to mid-sized businesses and entrepreneurs. Although every business is unique, they often share challenges that can be addressed through smart branding. Services include process improvement and operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our 5-Star business and personal branding company has helped a number of professionals and organizations to optimize and grow. The result is more business, more opportunities, better reach, positive outcomes. Please visit www.5starbdm.com to learn more and view all the episodes of Follow the Brand.
Well, how I stayed up to date with my field and mastering the knowledge of it, I enlist in subscriptions to denial management organizations which deal with revenue cycle. I also purchase webinars with internationally webinars, and I also research my field constantly because not every physician has the same path of denial errors. Some may be a scope of pulmonology, which is a different sector of denial. Some may be gastrology, which is a different sector of denial. Some may be hospital pediatrics. Some may be hospital where they predominantly have a scope of geriatrics care. Some may be a scope where a hospital field is a mixture and their high volume is commercial payer denials. Some may be a higher volume of Medicare denials, which where sometimes these are services that initially were paid and then turn around with an audit. They've reversed the services, and now you have to justify why these services were rendered in order to not endure a recoupment. So it's based on the scope of that provider needs that I do my research. And I always do an analysis of what their demographics are in order to deep dive and give them a true analysis.
Wow, I think that's very in-depth. So thank you for sharing that knowledge that what you're doing is very impactful in the industry. So I want to understand from a Gateway Healthcare Solutions perspective, so just so I'm clear, what is the major business problem that you feel that you can solve with your business that's going to be very, very impactful for a lot of different organizations out in the healthcare field?
As someone in the healthcare field, I feel that it's various problems that are occurring currently. Most of the times is based on complex information where the actual contract doesn't coincide with the services being rendered. Sometimes the payer may provide an authorization for a service and it's all on the green light to go. But on the underscope, you build a procedure code and then you find out that's not covered under the plan. It didn't correlate with the authorization that you were giving. So things like that, I'm able to assist. And I like when they have a challenging situation because it gives me the time and to preserve and provide my knowledge to them so I can assist them with making assessment properly and also providing information that will turn around their denials.
No, you said a lot there because I think the contracts, and you do a lot, you review contracts and you see some of the nuances and how it's written, and then you optimize those contracts, I believe, for your clients for
Yes.
them to be more impactful. Is that correct?
That is correct. I do a research methodology assessment and I give them feedback on the design of their contract model. And I give them advice on how to better maximize when it's time for their renewals. I give them verbiage to provide to the payer to assess a better percentage of reimbursement as well.
Man, that's great. That's how you're saving money, and I see that, and you're getting through a lot of the red tape and bureaucracy when it comes down to reimbursement and claims. I know that you're an expert in the CMS world, understanding how Medicaid, Medicare, and all those different regulations and compliance that's out there. I mean, it's got to be a lot of red tape. I don't know how you establish yourself as an expert in this field, but you've been doing it for a while. And let us know, how do you like that? How do you feel that you can truly impact someone that's starting out in revenue cycle? What kind of advice can you give to a person like that?
Well, the advice that I could give to them is once you learn your niche, that will set you apart from everyone because everyone has their own style and their own expertise. So you have to try to tailor what is your true expertise. And once you've gifted that, then you pursue it the best of your ability. Always try to deep dive into the system with like-minded professionals that has your same skill set for advice, possibly. Sometimes you may need another person may be going through another complex issue that your state may not incur at all, because different states have different types of healthcare coverage and the policies are very different. Some are similar, but they're not all the same. So you always want to tap into someone else in your sector to ask for advice, perhaps in those areas of what they are experiencing versus what you're experiencing in your field.
Wow, and that sounds a lot about your brand, how you live and conduct your work. And I believe you've got a tagline for GHS, Gateway Healthcare Solutions. Whoa. Can you share with us your tagline and give us a little bit more about how you live and conduct your business?
Yes, my tagline is delivering quality beyond expectations. And the goal is to not only provide excellent services, but is to provide a resolution where the doctors will not only receive a return, but it will be a longevity of services that you can provide to them to use for years and years to come. And that knowledge that they would pursue, that I'm able to pursue to them, will be an imaginable impression.
Oh, now that's awesome. And I see you're going to be offering not only your consulting services, but you're going to have workshops for people to get involved. They can get more information. Can you give us what is the URL for people to contact you via your website?
That is www.gatewayhealthcaresolutions.com.
Excellent. We cannot wait to go there and get the audience involved, because revenue cycle is huge. It's always top 5 on the priority list of initiatives for every healthcare institution, whether you're a large hospital system, whether you are running your own physician practice, whether you have a imaging or respiratory center or something to that effect. That is a key component. And you've set yourself apart as an expert. You've been doing this for a number of years. I believe you're going to be extremely successful. And my goal is to make sure that you have a chance to tell your story, tell it often to the right person. So before we conclude, I would like to give you an opportunity to talk about some things that we haven't discussed at this point that you want to give to our audience as an opportunity to engage with Bernadette Albury and the Gateway Healthcare Solutions, LLC.
Well, I would like to give to them that Gateway Healthcare Solutions is a great company to pursue doing business with, because not only do we have the knowledge of the business of healthcare finance, but we're constantly growing and elevating and evolving. We're also able to provide e-commerce packages with webinars, real timing, and we're also able to help you scale with in-service providing engagements for your customers as well.
So before we conclude, I would like to give you the opportunity to address the audience and talk to them about some of the other things that you're doing that you might not have already brought up to our attention at this point. So go right ahead, Ms. Bernadette Albury.
Yes, hi. I would like to tell the audience that using Gateway Healthcare Solution would be an assured impression. We are able to provide numerous of services, and I would like to give the audience information on upcoming webinars that we'll be doing, 101s. We'll also be doing some packaging for services for in-service offices, giving providers tutorials, and also providing insight for upcoming rules and regulations that are going to take place in 2022 for self-pays, and also giving information on how to better recollect your reimbursements. And that would be all.
Excellent. So there's a lot to look forward to. Cannot wait for the audience to engage with Gateway Healthcare Solutions. Make sure that you do tune in to her, as well as follow the brand. You can follow us at www.5starbdm, and that's B for brand, D for development, and for masters.com.